to finish the nutritional talk, are there supplements, vitamins, anything that you would recommend for a woman at this stage of life? You know, our view on supplements has always been, you know, it is exactly that. You're supplementing in what you are not getting from a regular diet. And yeah, touch on that.
Yes, absolutely. The two big ones are vitamin D3, especially after training, because it knocks inflammation down, and then you're able to absorb iron. Post-training, you have upregulation of this enzyme from the liver called hepcidin, and hepcidin inhibits your body's ability to absorb iron. But if you take vitamin D after training, it drops hepcidin, and then you can absorb iron. So you reduce your risk of becoming iron deficient or having low normal iron. Works in men too. But for this age group of women, creatine, and not from a bodybuilding standpoint, we're talking 3 to 5 gram doses a day only, not the 20. Doesn't have to be taken with carbohydrate. It can just be straight 3 to 5 grams for a variety of reasons. One, we store about 30 to 40% less than men, and we lose more as we get older. But we also know that creatine is responsible for all the fast energetics in our body. So the mucosal lining of our intestines, intestinal mobility, our brain health, our cardiovascular health. And we know that with perimenopause, we have a lot of neurotransmitter issues, which causes depression, anxiety, sympathetic drive. Creatine knocks that on the head as well, because we look at some of the RTCs of serotonin reuptake inhibitors, your typical prescription antidepressant versus creatine. People taking that 3 to 5 gram dose come out of a depressive, anxious episode a lot faster and stay out of it as long as they're using creatine as compared to an SSRI. So it is really, really beneficial at this point in a woman's life to be able to have that creatine available for the fast changing aspects that's happening in the brain. It also supports the nerve growth factor that happens with heavy lifting. So we want creatine. Those are the two big ones that I would suggest.
So
if someone's coming in the gym and they're complaining about having lots of vasomotor symptoms and hot flashes and it's interfering with their training, they can use the beta-alanine, because beta-alanine will help with that. It will be a vasodilator, and that will help with the temperature misstep that the hypothalamus is reading, because you will have more compliant blood vessels.
So dealing with hot flashes was one of the main questions that we got. And you say beta-alanine is one of the main things that you can do?
Yeah. Yep. And it's 1,000 milligrams, not enough to cause a tingling sensation. It's just a small enough dose to support body function.
Okay. And so again, one of the things that we see from a lot of clients is we talk about, you know, nutrient timing and when clients should be eating enough and how to get more protein. And they're like, I just can't eat that much, or they're not willing to eat that much. What are your thoughts on a protein supplement to supplement somebody that just can't seem to get enough whole foods in their diet?
Yeah, absolutely. It's a supplement, just like menopause hormone therapy. It's a therapy, it's a supplement to help you get through this transition. I know and use and love to support protein supplementation, because there are times when you just can't eat. You don't feel hungry, but you know you need it. And it is part of the whole cadre of foods that you can use to support what's going on.
Good. And is there whey versus plant-based? Is there any, you know, absorption, bioavailability that you can?
Yeah, so we look at the biological values, right? And we know that the egg white is 100. Whey protein isolate is 110, and whey concentrate is 80. So we don't want the whey concentrate, we want the whey hydrolysate or the whey isolate. If we're plant-based, then we want a pea protein isolate, and you can add some rice or some hemp to it, but pea protein isolate on its own is right on that cusp of enough leucine. So the two are really the two top end wheys, and pea protein isolate.
Awesome. That's really helpful information. We actually work with a company that does both of them. So